Hello, my name is Holly Hufnagel, and I'm going to share some experiences today from a 7-month training program that we've implemented in Nigeria and Uganda for veterinary paraprofessionals. It has 2 core areas of focus: business skills to ensure that the paravets have a sufficient income to continue their work in serving smallholder farmers, and preventive healthcare, as during our needs analysis, we identified core gaps in this area. At the start of our program, we asked ourselves, how can we measure the impact of this training? Number of VPPs trained gives us numbers, but no insight if the training was effective. Knowledge tests will bias towards those who were good at writing multiple choice questions and may not actually give real insight into their competency growth. Self-appraisal, you wonder also how reliable these results might be. We settled initially on using income of trained VPPs and number of vaccines delivered as good proxies for both the business and preventive healthcare impact. But then we realised they may not be that reliable. For example, we found during our needs assessment that the majority of veterinary paraprofessionals didn't keep any records. So how can we collect a reliable baseline on their income? And also the number of vaccines delivered depends in many countries also on the public vaccination programs that they might be running. So if we had a high number of livestock vaccinated by that VPP, it may not be thanks to our training, but due to a public vaccination program that coincided. So we wanted to find a more holistic approach to assess impact. Through discussions with colleagues at University of Edinburgh, Rob Kelly, we opted to follow the livelihoods framework approach. I'm sure many of you are familiar with this diagram, and we looked at their capital assets. So we undertook an online survey pre and post training to collect both quantitative data for the proxies we defined for each type of capital. We dropped natural capital as it was difficult to define how our training impacted on the environment. But for the 4 remaining here, you see some examples of the proxies that we developed for each type of capital. The list was in fact much longer. In addition to this quantitative assessment, we also undertook focus group discussions, gender disaggregated, with the veterinary paraprofessionals at the end of the training. So where are we now? I'd like to discuss some of the findings that we had from this approach. With regards to the challenges, we realised that with many proxies, you end up with a long survey, and that means, sadly, an attrition rate in terms of completion. So although you might have trained 50 paravets, only 40 or 30 of them might answer the post-training survey. Going forwards, we'd need to work out, can we condense the list of proxies further, or rather than having it as an online voluntary survey, using enumerators to go and ask in person. Again, there's always these trade-offs because it leads to greater costs of the M&E. There are also still some weaknesses of the proxies because we still had unreliable record keeping for some of the quantitative questions like number of visits, number of vaccines and income, which did figure underneath. However, because you have this triangulation of a number of proxies per type of capital, I do believe it's still more reliable. Another challenge was that for many types of capital, you won't see impact immediately. Especially financial and physical. It's only once the human and social capital has increased, they have greater income, so financial capital, and they can reinvest in their physical capital. So we really need commitment from donors and funders that we can go back 6 months, 1 year down the line to do these assessments. On the plus side, I already mentioned the triangulation. Also, it really enables this livelihoods framework to give us a more holistic view of the impact. And one of the success stories was really that under the social capital, only a minority of the veterinary paraprofessionals were registered with their veterinary statutory body pre-training, and post-training we actually had 100%. The qualitative assessment also helps bridge the gaps, which some of them I mentioned earlier. You might have not yet seen an impact on their financial, but through their testimonies already gained some insights. We'd like to hear from you. How do you measure impact from training? And to have a further discussion on this.